Hello, everyone. This is Dr. Joe, and I am coming to you live from my back porch. And since I'm doing a doctorly thing today, I thought I'd wear my stethoscope to make it look like I'm more doctory. But as part of my kind of series, that's not a true series of adding value to people from a medical standpoint. Hey, Hope. Hey, Pastor Moima from Kenya. Nice to see you guys. Well, today what I'm going to talk about is I'm going to talk about swollen legs. And there are a lot of different reasons for swollen legs. So I'm going to just talk about some of the basic ones and what we can do about it, because we know that they can be bothersome at times. And there's different levels. Of course, it could be your ankles, it could be your calves, could be all the way up. And the range, by the way, just go ahead and put in there, if you would, where you're watching from, because it's always fun to see how this whole thing works on Facebook Live, where people are coming from all over the place. But there's basically a range in swollen legs, from mild swelling that you might get after just sitting up for a while, or maybe after a heavy salt load in a meal, all the way up to severe elephantiasis, which is one of the most extreme forms of lymphedema and swelling. But I'm going to cover a few of the basics, some of the more common ones, and we'll cover some of the things that can be done about them. So first and foremost, one of the most common causes of swollen legs is going to be heavy salt load or sitting upright for too long. So what does that mean? Well, what that means is this, is I can fly back and forth across the country and never get any swelling in my legs or ankles. But when I fly all the way to India, from Tampa to Atlanta to Dubai, then to Hyderabad, then to Rajahmundry, that's a lot of time sitting up. And you really don't have the opportunity in an airplane to put your legs in the air. Or sometimes, as a person gets older, if they're sitting upright on long drives, same type of thing can happen. You can get swelling. That's not really pathologic. In other words, that's not necessarily a dangerous variety. That's usually just because you've been upright too long. Our bodies are designed at the end of the day to lie down and get rest. And during that time, just as if you took a glass of water and turned it sideways, that fluid levels out. The other thing that sometimes will happen with people is after a heavy meal that's loaded with salt. So for instance, somebody after Thanksgiving, or they go to a barbecue, or something where they have a heavy salt load, and maybe they don't usually have swelling at the feet or ankles, but they might get it there. And that's because that salt holds on to water. Salt in our bodies holds on to water. So these are things, those are some of the more common reasons. And again, those are not dangerous. Usually those can be taken care of by lying down, elevating your legs. If it's from a salt load, drink a bunch more water and that'll flush that out of your body. So now we're going to move towards some of the other causes. And again, these are things that sometimes might require seeing a physician, and I have to give the qualifier that I'm not here to give you medical advice above and beyond what your physician can. This is simply information. So hopefully you all can read the lines, because of course this is advice, but I can't take responsibility for what you do with it. So one of the other more common things, other than the ones we talked about, is injury. Let's say you take a wrong step, or you twist your ankle, or you're walking in the dark, or you have high heels on and you trip. What can happen is you could get a small tear in a ligament or a tendon. You can cause a sprain. You can cause a strain. You can cause a tear of a ligament, as I said, or you can even break a small bone in your foot. And sometimes when these things happen, most likely you're going to get some swelling. Usually that will be accompanied by pain. And let me just give a little bit of clarity. Sometimes people don't really know. What's the difference between a sprain and a strain, ligament, tendon, all these different things. So this is very simple anatomy 101 for you. Ligaments connect bone to bone. Tendons connect muscle to bone. A sprain is where you injure a tendon, a muscle, or you can also injure a ligament. A strain is where you actually tear a small bit of the muscle. And you can get that even in your feet or your ankles. So oftentimes if you have a sprain, a strain, or a fracture, which is just a fancy name for a broken bone, hairline fracture means it's a small broken bone. Non-displaced means that it's still in place. Pretty simple terminology. So a lot of times doctors throw these terms around. They're really very simple, and most of them are very descriptive. But if you have pain and it's due to a broken bone or a sprain or a strain, it will often be accompanied by not just pain, but swelling and oftentimes redness. Redness more often too with infection as well. So let's say you get a splinter in your foot. Well, you can get swelling from that. You'll also likely get redness and pain. So there's a wide variety of things, but we're talking more of a global swelling of the foot and or ankle. So let's say you're walking and your ankle turns in or turns out. There are more specific tendons and ligaments that might be injured, whether it's whether you go in or out with your ankle. But either way, if it starts swelling, first thing you want to do is ice it and elevate it. In fact, we call it RICE. Rest, ice, elevation, and what's the last thing? Let's see. Compression. So let's say, for instance, you do twist your ankle, it's swollen, you're concerned about it. If you're like most people, you're not going to go to the doctor, which may not necessarily be a good idea to not go. So what you want to do is you want to rice it. You want to rest it, put ice on it, wrap it with maybe an ACE bandage, or if you have one of those compression ankle braces, you can put one of those on and then elevate it. And again, last time, for those of you who saw my one on the on health for the legs, ankle needs to be above the knee, which needs to be above the level of the chest or heart to get true elevation, because our bodies are kind of like a big glass of water. The more they're upright, the more the fluid will set down. And the more we turn them upside down, the more the fluid can drain out. And of course, that's simplified. It usually will drain into the kidneys more or less. Hey, John. Hey, Alinda. Hey, Walter. Sharon, Jennifer, Holly, Marilyn, Alla, Elizabeth. Wow, we got a lot of people watching today. That is so great. And probably it's because a lot of people get swollen legs and nobody likes them. Nobody likes them. So with the injury, ice it, elevate it, compress it. Now, let's say, for instance, you do that. You're one of those anti-doctor types. You're not going to go to the doctor. I'm just going to make this one statement. If it persists 24 hours or more, it's not really getting better, in other words, no improvement, then go see somebody. Because if you've got a fracture there, you want to get it treated sooner than later. Another thing some people will do is they'll take anti-inflammatory medication that can also accelerate the process of getting the swelling down. But bear in mind that swelling due to an injury is a natural response to bring healing cells into the area and get things fixed. So we're moving on from injury now. Causes for swollen legs. Number 2 I have on my list here is pregnancy. Depending what age group you're in, this may not even be close to being an option for you. But if you're in that age group and you are pregnant, don't get too concerned if your feet swell, because that's a natural part of pregnancy, because a pregnant woman's body is designed to hold on to more water, more fluids when you're expecting. And also, just as we said before, because you stand throughout the day, it can be worse at the end of the day. It's always best to keep the legs elevated in the evening, and sometimes you might need to turn to one side or the other depending upon what stage of pregnancy you're in, because the weight of the uterus can sit on those veins in the pelvis, and we don't want it putting pressure on them. We want them to be able to drain. So even though it can be a little bit uncomfortable, usually is not a problem, with one exception. There is a condition during pregnancy called preeclampsia, which can lead to eclampsia, and that sometimes is not just the swollen legs, but it's also associated with maybe headache, nausea, trouble breathing, abdominal pain, and these can all be signs of these conditions. Usually will be at 20 weeks gestation or after, and this can be a serious issue, because if it's linked to high blood pressure, that can also do a job on your liver and kidneys, and it can be a serious problem. So be sure, if you're pregnant and you just have swollen legs at the end of the day, probably not a big deal. But if you have any of these other associated things, even if you just happen to think that it's morning sickness, let them check your blood pressure. After all, there's two lives going on here. It's not just yours, there's a baby involved as well. So bear in mind that with pregnancy, you can have the whole range. You can have mild normal swelling, or you can have a preeclamptic swelling, which is much more serious. Okay, moving on. Let me just check back here, see if there's any. Hey, Lynn, nice to see you. Kenny, Debbie, so good to see everyone on. The next one is kind of a weird condition in some ways. It's called lymphedema. And lymphedema is swelling due to kind of clogged lymph nodes, or they've been removed or damaged. So for instance, in the old days, whenever we would do mastectomies and we would take out all the lymph nodes, it was not uncommon for women to get a swollen arm, because all of the lymph is the fluid that's not within the blood vessels, the arteries and the veins. It's kind of outside and it's collected up. And that would cause, sometimes women would get a swollen arm, and that's lymphedema. Lymphedema can also be caused by some strange conditions. For instance, there's a condition called filariasis that clogs up the lymph nodes. There's other things that can clog up the lymph nodes as well. So if your lymph nodes are clogged, sometimes it's just because of an infection. The lymph nodes can swell up, and that can slow the drainage and cause swelling in the leg. But sometimes people have lymphedema because they just have sluggish lymph flow for one reason or another. Clogged lymph nodes that have been removed surgically, lymph nodes that are clogged, or just sluggish lymph drainage. Sometimes people have proposed this can be due to a poor diet, a diet high in fats and refined sugars and things like that. And so the first thing I personally recommend for people with lymphedema is clean up your nutrition. Lots of fruits, vegetables, clean eating, try and stay away from super refined things and things like that. The next thing we recommend is keep it elevated. Now bear in mind, the fluid will not come out of a leg with lymphedema as easily as it will from a more standard swelling. And the reason for that is just like the example I gave before. I don't know what happened there, so I'm just going to continue. But the example I gave before of taking the glass of water and turning it upside down and having the fluid flow out in the evening is an example of, for instance, when the fluid is just more of a standard fluid. When it's in the lymph glands or the lymphatic tissue, it's more like trying to hold up a sponge and have all the water come out. It'll do it, but it has to be held up longer and sometimes requires some squeezing. And that's why what we have is these things called sequential compression. There are devices that will go on your legs and they'll squeeze them. They'll start at the ankle and gradually squeeze to push the fluid back into the tissues and up into your body. So this is lymphedema. Now, usually you can tell the difference between lymphedema and the other kind of standard swelling. There's a very, very simple test that you can do. Now, it's not always 100%, and if both lymphedema and more standard swelling are there at the same time, it won't exactly happen. But that's this. If you press your finger into the shin area or the top of the foot and you get a big indentation that doesn't rebound, it's probably not lymphedema. With lymphedema, you press it in and it'll usually spring right back out. Kind of do one of these. Wee, meow, wee, meow. Okay, I think you know what I mean. It just kind of springs right back out. But you don't get that with swelling from some of the other reasons. So we're going to move on from lymphedema. Lymphedema, by the way, can be a big problem for people, and that's why it's important to get that under control fairly quickly before it gets too bad and progresses to elephantiasis, where the skin thickens and is very difficult to treat. Next on my list, I have chronic venous insufficiency, and that's because our veins are designed to get the blood back to our heart, then goes to the lungs, gets oxygen, and then goes out. But sometimes if the valves aren't working properly and the veins are not getting the blood back to the heart, you can get chronic venous insufficiency. And when that happens, oftentimes the valves can get injured because there's one-way valves inside the vein. They're very, very thin, almost like a butterfly's wings. But what happens is the blood goes through, they open up, and then they kind of, like a one-way valve is what they are. But if those get injured, you can see that the fluid then can go back the other direction and cause swelling. If this happens over a prolonged period of time, you can get ulcers in the legs, you can get thickened skin, you can get what we call brawny edema, where the skin gets scarred down and thickened and brownish. And so that is, when you see people with that, that's because they've had it for a long time. The treatment for that, again, elevation, compression stockings, maybe not the kind that you have to electronically push the fluid out, but if you wear those whenever you're going to be upright for an extended period of time, that can definitely help. Just have a few more things here. One, which is very, very important, heart failure. Your heart isn't pumping the blood out like it should, so it backs up. Much like if you picture your heart pump as being like a water pump inside a little boat, a small boat. And whenever water gets in, it's brought in regularly so the pump can pump it out. What happens is if the pump is not working right, the water builds up and eventually backs up. And that's when it backs up into the legs and feet, causes swelling. Usually it's difficult to lie down flat with that condition. Sometimes people will have 2 or 3 pillows they'll need to, or they'll need to sit up in order to sleep well. You might notice some different abnormal heart rhythms, difficulty breathing, especially if you walk. Excuse me. Heart failure can be a very serious condition. That's one that you should definitely get to the doctor right away. If you have swelling in your legs, you get tired easily, you have difficulty breathing, you have difficulty walking, get to the doctor right away or do whatever alternative thing you want, but don't let it linger and don't just let it get worse because it can be severe. Next two are also very important. Kidney disease. Our kidneys filter the blood. If they're not working right from, say, diabetes, high blood pressure, maybe you've just got straight kidney disease, then your body holds on to more water, and because of gravity, and we're upright most of the day, it can go down to the legs. So if any of these, and again, with the kidneys will be a situation where you likely will be a little bit short of breath as well. Next, and this is the last major medical condition that I'm going to cover here, is liver disease. If you have inflammation in your liver, let's say from drinking heavily, or you've had hepatitis in the past or something like that, scar tissue replaces the healthy tissue of the liver. The liver doesn't work right, and so the fluid can swell up in your belly, your legs, and your feet. This is a little bit different of a condition. Again, very serious, excuse me, and also needs to be taken care of. So remember, for simple conditions, be sure that you keep your legs going, walk around. If you're driving long distances, get out every couple of hours, take a walk, put the legs up when you can. Remember, elevation means ankle, above the knee, above the chest. So that will help for just minor swelling conditions, but always call your doctor if when you press in, it leaves a significant dimple, if the skin looks like it's stretched or going to break, if there's pain that doesn't go away, or if any of these are associated with high blood pressure, difficulty breathing, or severe tiredness. So that's it. That's all I have now. I know that, so I see Gina, it looks like you had a possibility of lymphedema. Usually, and this is very interesting, you said that they took the lymph nodes. In the old days, we used to do radical mastectomies. Radical because it would take the pectoralis major, the pectoralis minor, and all the muscles and all the lymph nodes. In more recent years, we've started taking just the pectoralis minor, the smaller muscle underneath. And so those lymph nodes, we don't take all the lymph nodes. We take a sampling. So lymphedema is much less likely. But I am so glad that you don't have any lymphedema because it's not that common anymore. We do warn people about it, but it would be a shame for your beauty to be marred by that. So I am glad to hear that. So I'm so sorry that this had to be mixed up into two different lives, but thanks everybody for joining. Share this on your page if you want. Share both of them. I'm going to see if I can maybe splice them together. I don't know. I'm not a tech guy. I say that, but I'm pretty good. And I hope you all have an awesome day. And remember, if your feet swell, lift them up. Drink more water. Get some exercise. Have fun, and remember that your body is the only one that you have, so take care of it because you can be an example to other people and you can be an influence for the positive in a lot of lives. God bless you all, and we'll see you again on a Lunch and Learn one of these days.